Hello, and welcome to Health is the Key, the podcast that explores the health and wellness issues that matter to 1199 SEIU healthcare workers. I'm your host, Elizabeth Moore. June is National Men's Health Awareness Month, a time to focus on the unique health challenges and risks that men face. Although men have higher rates of chronic disease than women, they are actually less likely to get regular checkups. If this sounds like you, or like a man you know, we're glad you tuned in. Joining us today is Dr. Martin Karpeh, Director of Surgical Oncology for Northwell Health Eastern Region and Chairman of Surgery at Huntington Hospital. Dr. Karpeh will talk to us about why it's so important for men to make their health a priority, not just once a year in June, but all year long. Welcome to Health is the Key, Dr. Karpeh.
Thank you, Elizabeth. Happy to be here.
So, we learned that men are significantly less likely than women to seek preventive care and more likely not to have a primary care provider. Can you explain why?
I'm not sure I can explain why, but it is a fact. And quite often, I tell my patients that single men usually don't live as long as married men because their spouses usually look after them. But it is true, and it may be that, women pay more attention to not only themselves but those around them. Men tend to be a little bit more isolated, and are focused on the daily matters of life, and usually not paying attention to themselves. Certainly, younger men don't feel that they're ever going to get sick and
they feel
don't
invincible.
need. Absolutely. That invincibility is a factor. And
how is that working out for them?
Not so good.
Not so
good. We're seeing increases in certain types of cancers and certainly health conditions, and they're picked up, unfortunately, a bit later. We know as a surgical oncologist that picking up cancers early allows us to cure many, many more patients. And so trying to get patients to the hospital, to the doctors early is a key. And women are used to this, breast cancer being the number one cancer in America. There's a lot of focus on screening, and I think many women are used to getting their mammograms and getting checked up, and we don't pay as much attention to prostate, which is the second leading cause of cancer.
That's what I wanted to ask you about, because women, how to work around this, get men to take better care of themselves and practice preventive care. Women have their annual gynecology visit, and men don't really have that. So what are some other ways that we can get men to take care? We were wondering, can telehealth bridge the gap a little bit?
Yeah, it's a great thought and a great use of telehealth. I think the problem really starts earlier on. I think that just as a society, we need to focus more on primary care and prevention, and that's really for everyone. We tend to focus on, like I said, some of the more common cancers that tend to affect women. Of course, colon cancer is also, very, very common and affects both men and women. I think trying to be a bit more proactive in getting patients to see doctors, and telehealth is one way of doing that. It makes it easier, and we're all busy, and everyone is, tied up with other things, and you don't tend to think about your health. But it is a good, I think, screening tool and a good way to sort of get people connected with the health system. But ultimately, I think, having a physical exam is important at least once a year.
Right. The follow-up is key.
Yeah.
And can you just give us a brief background on what kind of cancers or health conditions that men are more prone to than women?
So clearly prostate cancer heads the list, and that risk increases with age. Certainly certain men have a higher propensity, and it runs in their family. So certainly if you're a male who's had prostate cancer in the family, you probably need to get checked out at least maybe 10 years earlier than that family member to start getting screened.
And is there a biological component to why men may be more susceptible to certain diseases than women?
It's certainly, again, in cancer, we do see it more frequently, but, there are certain cancers and conditions that affect women more frequently. But we don't know necessarily why men or women are more prone to general cancers. For instance, colorectal cancer, men have a higher incidence than women, and that's probably true for most gastrointestinal cancers. Why that is, we're not quite sure.
So since we know that preventive care is key to avoiding certain cancers, certain conditions, what are some of the key screenings young men should get, middle-aged? If you could just sort of run down that list.
So, for young men, we're talking before age 25, say, we're not necessarily worried about cancers. I think the big emphasis is really on healthy lifestyle, avoiding smoking, decreasing alcohol intake, developing good, sleep habits, and things that are just going to be good long term. And many of the cancers that we see in older age are due to behaviors that occurred early in life. So really getting young men to just practice good, healthy lifestyles, getting vaccinations on time. Unfortunately, one of the cancers that we're seeing an increase in are liver cancers, and it's not a big percentage of cancers that we see in this country, but it's increasing and alarmingly in both men and women, but more so in men. And we know that hepatitis exposure is a reason for that. So getting Hep B vaccinations early in life is important. And if you are affected by hepatitis C, getting treated early is important. And some of the risky lifestyles that may lead to a Hep C infection may occur more likely in younger men. And then, getting towards middle age, again, we begin to worry more about screening for colon cancer. We're unfortunately seeing a rise in colon cancer amongst the young. And so the recommendations now have been pushed up from screening at age 50 to screening at age 45.
Right.
And that really goes to all GI cancers. Unfortunately, we don't have good screening techniques for the other cancers. But again, getting an annual checkup, investigating symptoms is really important. So again, getting to the doctor is key because we all have aches and pains, and we don't necessarily link them to any particular ailment. And that's where a doctor can come in.
Right.
Yeah.
And that's when I wanted to ask you about men do tend to downplay symptoms, they try to tough it out. What are some symptoms men should not overlook? What should they pay attention to?
Sure. Well, unexpected weight loss is something that it kind of comes on suddenly, but should be checked out. Obviously, new persistent pains of any kind. Everyone takes an Advil or an aspirin or something, but if that pain is a nagging pain that comes back, it needs to be checked out. Of course, seeing blood in feces or urine is certainly something that should not wait.
Right.
That needs to get checked out right away. Things like fatigue are very, very common, and it's really hard to run to the doctor because you're tired. But
we're all tired, right?
Yeah, exactly. But if you have fatigue and weight loss, those things in combination, it's a sign that something's going on.
One of the interesting things that you participated in a panel discussion on Black men and prostate cancer. And one of the takeaways that I got was you need to be a strong advocate for yourself. You need to pursue treatment and be upfront with your doctor. And do you find that men tend to do that, or do they sort of recede and let their wives take the lead?
The whole point of that videotape was really to get the word out that you really shouldn't give in to your natural tendencies, because we often aren't thinking that anything's going to happen to us. And I think, seeing somebody like Allen Houston, who's
the NBA star.
NBA star, healthy, no one would imagine that he would have gone through something like prostate cancer, and then having a family history again is a clue that you need to be looking for changes and screening for yourself,
right?
Because you can get prostate cancer, but it can be cured. And seeing those men in that tape who are alive and well on the other end of prostate cancer treatment, I think was a great testament to the value of screening and early treatment.
So say you get your loved one, if you're a man yourself, you've decided to go see a PCP, or you're a wife, a mother, a sister. What should a man look for when they're looking for a PCP, primary care physician?
Yeah, I think a lot of men look for physicians that look like themselves or similar age. I think it's a lot easier to relate to someone who you feel comfortable with. And number one issue is trust. And there's been a long history of distrust amongst African Americans in the healthcare system. And so trying to get folks that, again, look like you and understand your background is one barrier that that we need to get over. But I think that making that connection, my doctor is a woman, and she does a very good job.
It just matters that you connect.
Matters that you connect. Yeah. Absolutely.
And they listen.
Yes. Yeah. And you don't have to stick with that doctor if you don't have that connection.
We try to emphasize that a lot. That if you're not feeling right, if you don't feel heard, if your questions aren't being answered, you can find someone else.
Right, and that gets back to your earlier question about advocating for yourself. I think if you don't feel that you're being heard, or your symptoms are being brushed off, don't stop there. And there were a number of stories where the physician really didn't hear the patient, and they went elsewhere, or their wives got them to see someone else, and lo and behold, they did have a problem. So don't if you don't feel well, pursue.
Yeah, trust your gut.
Trust your gut. Yeah.
And I was curious, do you approach female and male patients differently? Do you relate to them differently?
In my own practice, I try to lead with the facts, and everybody takes those facts differently. And I don't necessarily see that there's a gender difference. It really comes down to personality. Some people like the truth right up front. Some people, like to ease into a conversation. And I think if you're listening, you're trying to kind of pick up on those clues, because it is important that my approach is not the same for everybody, because my goal is to connect.
Right. So it's tailored to each person.
It has to be tailored to each person, and that comes down to personality.
One of the things that we didn't talk about is mental health. Mental health is a major issue in the United States, and it's not just men. It's the stigma really does exist still, but it does hit men harder.
Yeah.
Maybe because of societal pressures. What is your understanding of how to approach men getting mental health?
It's not easy, and we're seeing, I think, a rise in the number of homeless, which is kind of an indirect reflection on mental health. It's difficult because, again, people don't necessarily want to bring attention to the fact that maybe they're not feeling well or they're feeling depressed. I think, though, that nowadays there are more avenues than ever before. The rise in the use of your phone and having access to therapists is much easier now than in the past. And again, it's really a matter of getting people to know that it's okay. It's absolutely okay to reach out to someone. And I think having that anonymity of someone that you don't know on the phone, that you're just able to kind of just unload a lot of what's on your mind is very, very healthy. And I think it's important for people to know that depression and feeling sort of isolated at times is part of the human condition. We all go through it. It's just a matter of whether you're able to, get out on the other side and not let it hold you down. But it's an important issue, and everything's kind of connected. When you're feeling well, you're less likely to be depressed. So eating well, making sure that you get 7 to 9 hours of sleep if possible, having a routine, all these things help to just have you kind of an equal balance.
Right. And mental health has such an impact on physical health and vice versa.
It absolutely does. It absolutely does. If you just don't feel like doing anything, you're not motivated to get out and exercise. You're not motivated to eat well. It's totally connected. Yeah.
And I think with men in particular, both mental health and physical health, it's admitting that they're quote unquote weak. It's admitting to, I'm not as strong as everybody expects me to be. And so getting past that is hard.
It is. And I think seeing examples of other men getting out and exercising and taking care of themselves, having podcasts like this, I think help.
Getting the word out.
Getting the word out. Yeah.
Okay, so we know that nagging doesn't work.
Right.
At least I've learned that. So how do you get the men in your life to take care of themselves?
It's not easy. Having group events help, trying to get men to participate in events that involve other men. Prostate awareness is a big thing, and there are a lot of group chats and events around to educate people and just, again, getting people to understand how important it is will help.
Yeah.
There's unfortunately not a great answer to that question, but I think anything that lowers the stigma about seeing a physician, it's not a painful thing to have a physical exam, and just making sure that you get your blood work done at least once a year will pick up things that you're not necessarily aware of. And I think it's also helpful because men are not as, I don't think, social as women. Trying to get men in social settings to talk about health is also very helpful.
Letting them know they're not alone.
Exactly. Yeah.
Well, that sort of brings me to my final question. What is one thing you would advise men? Like, if you're not going to do anything else, what is the one thing that you can do today to get a little jump start on taking care of yourself?
I would say focusing on diet and rest is key. Again, it sounds cliche to eat a well-balanced diet, but more fruits and vegetables have natural anti-inflammatory components, and that's why people talk about how important it is to eat fruits and vegetables. Stay away from processed meats and too much sugar, too much salt. All these things directly impact your health over time. And moderation is also key. So I think if anything, if you're not able to see a doctor, at least getting healthy lifestyle practices will be very helpful in the long run.
Okay. I think that's a great motivator, and I hope our listeners will take it to heart. We want to thank you for coming to see us today.
My pleasure.
We learned a lot.
Thank you. Thank you for having me.
Tune in to our June keynote later this month to hear Dr. Karpeh talk about his participation in a panel discussion on the increased risk of prostate cancer among Black men and the truths that the survivors shared. For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.